This is a continuation where I'm explaining the different product lines and the testing methodologies behind immunodiffusion, complement fixation, and latex and yeast agglutination. In this video, I'm going to explain how latex and yeast agglutination tests work. Latex agglutination, it's kind of in the name. So agglutination or clumping, that is going to be a positive result, and then no clumping is going to be a negative result. The latex looks like milk. So if your milk gets all clumpy, then that's positive, and if it's not, then that's negative. And how the test works is antigen can be applied to those latex beads, and then if the patient has serum antibodies against those, they will bind, but they cross-link, they form this network. Antibody has two hands, and there can be multiple antibodies multiple antigen per bead. So if you think about all these antibodies reaching out and grabbing two things, you can form, if you grab a buddy and you grab a buddy and you grab a buddy and all these groups grab buddies, then you're going to start to form this network, this mesh, this aggregate or clumping or agglutination is what that starts to look like. And that's the theory behind the testing. An antigen or antibody on the latex bead, and you can detect the other one with that. So if there's antigen on the bead, you can detect antibody. If there's antibody on the bead, you can detect antigen. At ME, there are tests that do both. But that's how that test is working. There's one of those particles, antigen or antibody, bound to that latex bead, and then clumping is detection of the opposite. So if you have a patient sample and you have antibodies against the antigen, and that patient has antigen in their blood, it'll get detected, or vice versa. Yeast agglutination works very similarly, except instead of having antigen attached to the latex bead, the yeast cells themselves are the beads. The antibodies will attach to them. It forms clumping. And clumps, aggregates, agglutination, that is a positive result. And a lack of that, the solution staying cloudy, that is going to be a negative result. So that's latex and yeast agglutination in a nutshell.